All right, thanks everyone again for joining me on this webinar. As we talk about hamstring-related injuries, and specifically avulsion or apophysitis type injuries in gymnasts. Hamstring injuries are actually, any muscular injury is actually a very easy injury to recover from. And why it's easy is because the body is designed really well to deal with muscular related injuries. And how I can say that is because if you look at all the tissues in the body, the muscles actually get the most amount of blood supply. They get the most amount of oxygenation. They get the most amount of nutrients. So left to themselves, they can recover quite well. We know very clearly the timeline of how long it takes to recover from a grade 1 tear to a grade 2 tear, or replace tear for strain, or a grade 3 strain. We know how long it generally takes, and even if someone doesn't really care for themselves, like get therapeutic care or treatment, pretty consistently we know the timelines in which they recover. So when I talk about hamstring related injuries, as far as gymnastics goes, it doesn't necessarily relate to the actual muscle being injured, but more so where the tendon and eventually where the tendon and the bone meet. Anytime we have transitions between one type of cell to another, so from a muscle cell to a tendon cell, or a tendon cell to a bone cell, those transitional areas are the most vulnerable to injury. And not only are they most vulnerable, they're actually the hardest to recover from and repair from. The body doesn't repair itself very well in those locations. If someone tears their Achilles tendon in the meat of the tendon, they're going to have a much better outcome than if they tear their Achilles tendon right around the point where the tendon and the muscle are blending into each other. Well, as gymnasts, one of the common types of injuries that they get is one of these transitional areas, and in and around the growth plates. And it's transitional until it fuses and it becomes a full mature bone. But until that point, it's a transitional area, and it's very susceptible to injury and trauma. And as coaches, you guys are all familiar with various different growth plate related injuries that gymnasts will get. And they exist in the upper and lower extremity, like in the upper body and in the lower body. They're way more common in the lower body. So there are the two that happen typically around the knee. Everyone is familiar with Osgood's, where it connects into the shin bone, but also where the tendon blends into the kneecap. The Sinding Larson Johansson syndrome is another way it manifests itself. Everyone's familiar with severs in the heel. You may not be familiar with the name Isometric, but it's also, you probably have seen it with your gymnasts where they have apophysitis or irritation at the growth plate, where at the bottom of the fifth toe, the pinky toe. Let's say if they roll their ankles, sometimes they can get an avulsion fracture at that level. So those ones are fairly common, and mostly known in the gymnastics world. Another one that's equally as common, especially with female gymnastics, it exists in male gymnastics, but not nearly to the same extent. And that is the ischial apophysitis, or Kremser's disease. One day I'll discover something and I'll attach my name onto it too. But for now, I'm stuck repeating other people's names. So Kremser's disease, or ischial apophysitis, is essentially a growth plate related issue at the point where the hamstring tendon connects into the bone. And it's typically a traction type injury, meaning there's so much of a pull on that secondary growth plate that eventually over time starts to cause irritation, inflammation of the cartilage. So if I use my fist, think of this as a very mature bone, and this is the other aspect of the bone. Until the bone fully matures, we essentially have two bony elements, and in between here, there's cartilage. So as there's pulling on this end of the bone, you can get little irritations like this and inflammations at the point of the cartilage, and that's what is an apophysitis. If it's severe enough or not managed well or picked up early enough, you can then just rip this off completely, and that's when it becomes avulsed, or we get a fracture at that point. It's quite common in gymnastics. as that stat shows at the bottom, in female gymnastics, in some clubs, you may find 1 out of 4 gymnasts dealing with this issue at some point in time in their gymnastics career. So it's quite common. Hence why it's important for us to be able to recognize it and then do things to try to mitigate or reduce the likelihood of it occurring. So this picture just shows you all the different places where we have secondary growth plates, where typically people can get an apophysitis around the hips or the pelvic girdle area. Most of this is not too common, except if you look on that picture on the left-hand side where it says AIIS, rectus femoris muscle attachment. That one can be a common one as well. Not as frequently, but can be a common as well. The one at the bottom there, though, the ischial tuberosity, where the hamstring muscles attach, that is very common in the sport of gymnastics, especially with women's gymnastics. And it's not just that the hamstring attaches there. We have other muscles that attach there. In fact, we have one of our muscles, one of the primary muscles that's involved in movement of the legs, which is actually part of our inner thigh muscles, also has some connections there. So why that's important for us to know is because not only can traction or irritation of this secondary growth plate occur when the hamstrings are tugging at it, but also when these inner thigh muscles are also pulling at it. So the first thing that may go through your mind is looking at all the leaps that you do, the front leaps, the side leaps. All these leaps are pulling or tractioning or tugging at this particular growth plate and could potentially cause irritation or injury to occur, and maybe, hopefully not, an avulsion to occur. So why do they happen? The very simple answer is typically overuse. What happens is there's too much loading on those tissues that connects to that bone, and as a result of the excessive loading, the tissue cannot tolerate it, or more accurately, where that secondary growth plate is can't handle that constant tugging, and then you get inflammation of that cartilage area in between and irritation that presents as apophysitis. Eventually, if it's not managed well, or if it's a hard enough load or force put through it, you can actually have an avulsion fracture. When it is also, we're most susceptible to it. I mean, you could have a gymnast who can be overusing the area throughout their whole career, but there are particular timelines where they're more likely or more at risk of developing something like this. And that's generally where there's some alterations in the body's metabolic capacity. And by metabolic capacity, essentially I mean is how much energy tissues can withstand. And so what affects energy requirements within tissues is growth periods, is hormonal changes, is change in dietary, drastic changes in dietary, or huge limitations or within their dietary intake. All these things disrupt the body's energy management capacity. Those specific ones obviously being the hormonal and the growth, and sometimes they're very much related. So if you look at the times when apophysitis, which is the initial irritation of this growth plate occurs, it generally is around when most female gymnasts are in the midst of their growing period and the beginnings of their of puberty. So you have the double whammy of hormonal changes and growth plate changes and growing in general that lends themselves to potentially developing this growth plate related issue. In fact, this is the case with all the growth plate related injuries, but specifically since we're talking about this. Now, if an apophysitis isn't managed well, or the underlying mechanisms that contributed to it isn't managed well, you're more likely to then eventually start to see an avulsion fracture. And it usually shows up a little bit later in age, closer towards their full maturity, because at that point, you no longer are irritating that sort of secondary growth plate. It's fused. Now you're just sort of pulling it off entirely. However, avulsion fractures can happen with the younger gymnasts as well. So what I would say is typically you'll start to see this present in young female gymnasts as early as 12 years old, peaking at around 14 years old, and can sometimes even be present up until 16 years old. somewhere along 14 to 18 or 19 years old is likely when you're going to see most of the avulsions happen. And so there is an overuse element of it, and we'll talk about the ways in which it's overused. There is a metabolic or growth-related element to it, but even with all those things, the other key component of it is that there's a lack of capacity for those tissues to handle load. And so there are things that we can do, obviously, to manage training volume, to limit its overuse. And we'll talk about that. There's obviously things we can do to limit what the metabolic changes that are naturally happening during growth, to limit its negative effects on us. And we'll talk about that. But where we'll have probably the biggest tangible effect is making sure our gymnasts have the capacity to load this particular tissue so as to not cause irritation at that secondary growth plate. And so I'm going to spend a lot of time at the end talking about that. At the end of the day, why you get injuries is it's a very simple formula. You get injured because whatever load you put on the body is greater than its capacity. So if we can increase the body's capacity to handle that load, by virtue, we're going to reduce or mitigate the likelihood of injury occurring. Now, we can reduce the load if the capacity isn't great, and usually that's what you need to do initially. So, initially when people get injured or going through growth, we'll talk about ways that you can reduce volume or loading initially, but ultimately we need to increase capacity because so as to avoid the likelihood of one of these avulsion fractures happening later on. So generally, a poor capacity in the tissues in and around the pelvic girdle that lends itself to an apophysitis or growth plate issue at the hamstrings is a lack of passive flexibility. Obviously, if you lack the flexibility in the tissue to go through the ranges of motion that you require it to go through as a coach or as a gymnast, then we're tugging on that bone excessively. Now, I would argue that pretty much 95% of your gymnasts, especially at the 12, 13, 14 years of age, passive flexibility, for the most part, isn't their issue. And I'll expand on that later, but if you've heard me speak before, you know where I'm going to go with this. Another aspect that contributes to poor capacity is poor pelvic control and core control. So what I mean by that is, we do a lot of core conditioning in the sport of gymnastics. They're pretty consistent in terms of the exercises that are done by coaches, not only right now amongst coaches, but through the years amongst coaches. There are particular exercises that traditionally have been done, and most of them are really great. But if that's all that we're doing, we're not necessarily addressing or always dealing with developing a really good core stability, core control, pelvic stability, pelvic control. And how this negatively eventually can affect a gymnast is that if a part of the body doesn't have really great stability or control, what your body does then is to try to create stability and control by going to the adjacent joints, for example. So if I have poor stability around my core area, then what my body will do is try to create stability in my hip girdle to make up for it. The negative of that is the hip joint and the hip girdle is meant to be very mobile. So if I'm going to create stability at a very mobile joint, I'm now eliminating some of its capacity to be mobile. So for that reason, although we're dealing with growth plate related issues at the hamstrings, what we need to also appreciate that if pelvic control and core control isn't really great, then we're putting the hamstrings and the tissues that eventually connects into the bone where this growth plate issue occurs at risk of excessive tugging and irritation. So we'll talk a little bit about that and ways that you can try to address for that in conditioning. And this goes a little bit to my point of what I was saying about the traditional types of exercises that are done. There are particular ways and approaches that coaches have learned to train and develop their athletes. And they work, and they're efficient, and they're effective. The only area where I sometimes question for myself is a lot of these methods and approaches worked because when they were applied, the gymnasts were never doing the kind of skills that they're doing now. When they were applied, the gymnasts didn't have the same kind of distractions or, they didn't have the same, our food quality today is not the same food quality we had 20 years ago. Just to give you an example, to have the same mineral or nutrient from an apple that was eaten in 1960, we need to have the equivalent of 57 apples today. So our food quality is not the same. So the individuals that we're working with aren't the same kind of individuals that were being worked with when a lot of these approaches were being established 20, 30, maybe 40 years ago. So there are particular ways that we've trained athletes, and some of these particular ways may actually be contributing to some of the core instability or pelvic instability that then causes excessive tension to be put on that growth plate. So that's something that we need to be able to examine as coaches, as people in the gymnastics community, so that we're always looking at providing the kind of things or loading strategies for the athletes that's going to be specific and pertinent to the athlete that we're working with today, not necessarily the things that work with the athletes 10 years ago or 20 years ago, because the athlete is different and the requirement of the sport is different. So just to give you an example, a lot of the things that are done in the sport of gymnastics as far as conditioning goes, sometimes can lead to the creation of an athlete who may stand like this. Now, this may not seem like a big deal to you, except what's happening at the pelvic girdle is you have this excessive curvature in the lower back. It's causing this tilting in the pelvis, and that tilting is creating a lot of tension in this hamstring and set of tissues that make up our hamstring. So I go to then kick my leg up to do a front leap. I have so much more tension being generated in my hamstring. Something as simple as having the gymnast hollow themselves out before they do a leap, you'll notice do a stretch, you'll notice they'll be able to go through a greater range, mostly because they've neutralized a lot of the compensatory effects that have happened to the hamstring tension through the altered pelvic and core stability or control. So this is one way that we instantly, before we even do any strengthening exercises or ask any skill of our gymnasts, we've now taxed this growth plate a little bit more because of the excessive tension created because of the really poor core control and pelvic control. So then, the gymnast will go up and do things like this, like doing a leap. And, in a previous webinar, I showed how this contributes to back-related issues. Well, this also will contribute to hamstring-related issues. So that front leg that's pulling up, because the hips are tilted, we've now, if I had an elastic band here somewhere, let me just try to find it, because then I can give you a visual. Okay, well, just when I need it, it's not here. But anyways, that tilt of the pelvis tilting this way all of a sudden created a lot of tension along that hamstring, though, that front leg that's gone up. So now they're kicking up and creating even more tension along that tissue, while the muscles can handle that tension. The muscles are the least likely in an adolescent athlete or prepubescent or pubescent athlete. The muscle tissue will handle that tension. The tendon tissue will even be able to handle that tension. The growth plate will not be able to handle that tension. So then what you start to get is minor irritations and eventually major irritations to that growth plate that manifests itself in an apophysitis or a growth plate related issue. As the gymnast gets older, it's the muscle, it's the tendon that will become problematic. But when they're prepubescent or pubescent, it's going to be the bone. It's going to be where that tendon and the bone meet, that transitional tissue there, where they'll likely develop irritations, and eventually that transitional area where the bones haven't completely fused. So here's a picture of Simone Biles. She obviously, as you can tell, she has really good core control. She has a pretty good, there's not negative effects happening on her back there with excessive arching, but the tilt in her hips is sufficient that she's not having to excessively load that that hamstring tissue. Meaning, as she kicks her leg up, she has less resistance of tissue underneath here blocking her, and it makes it even easier for her to be able to lift her leg up. So when we do skills, not just like leaps, but when you do skills like toe-on or Stalders, you are getting yourself in this position where you're going to excessively load this particular tissue that's going to pull and tug on this secondary growth plate. And so a lot of times irritations can start when they're doing these kinds of skills because they're equally tugging on that bone, that secondary growth plate. And then they go and do a leap or something else that has even more force put through it. And then that's when the major symptoms start to present themselves. So I want to demonstrate this because the irritation starts from any single time they're having to flex their hip up and put tension through this tissue, including skills like on bars that may seem like it's unrelated and there isn't, major loads being put through it. There's a couple of videos I want to show of just going over again how if there is really poor control, pelvic control or core control, or a lack of capacity to go through that full range of motion that they require, every single time a gymnast will do a leap, they're tugging at that secondary growth plate excessively. And then sometimes what happens is, gymnastics coaches will want to build and work on that leap. So then they'll say, let's tie a band on that leg. So you now have double the amount of resistance being put on that tissue, not only resistance from their own tissue, but now resistance from the band. And this also can expose them to excessive loads being put on that secondary growth plate from the tugging action of the hamstring tissues. Okay, so then what is it that we need to do to mitigate the likelihood of this kind of injury happening? And coincidentally, I think in the last 3 years, obviously last year we didn't have a national, so the 2 nationals before that, I came across 4 different athletes who had this particular injury. And I'm not treating every athlete when I'm at these nationals. A lot of times it's just the national athletes, sometimes some provincial athletes. So 4 is quite a high number from the number of people that I was treating. I thought 4 was a very high number of people who had this particular issue. So the reason I mention that is because I think the occurrence of it is quite high. So it's important for us to be able to then obviously mitigate it. First and foremost, managing volume. There are a lot of times when the belief may be that a gymnast needs to do a lot of something to become really good at that something. I'm going to share with you what happened. I was a strength coach before I was a chiropractor, and I worked with our women's Olympic hockey team one year. And what we did with them one summer is normally they strength train like 4 or 5 times a week, and they're on the ice every day, and they're 2 months that they have off. This one particular off-season week, their strength routine consisted of only 2 workouts a week. And every 3rd or 4th week, we had a down week in terms of the volume and load really dropping. At first, that was really hard to take because they're used to training so much more, and they only have 2 months of an off-season, so their opportunity to build strength is very small. And but very quickly, what they noticed is with the lower training volumes, that they actually allowed for higher recovery, and their performance or their strength and their power and their speed improved every single time we transitioned the program or came out of that little bit of a recovery week. So why I share that is, in some cases with some of your athletes, you may be surprised that less can be more with them. So trying to figure that out, especially near the pubescent time, will be a very critical time to be able to manage volume, so we reduce the likelihood of this. So watch the numbers that you do in a given training in a given week, and just make sure there isn't sharp increases within those numbers. If you have done 10 reps of this, 20 reps of this, and 30 reps of this skill, or in total you've done maybe 60 different repetitions of something that could tug on that hamstring. So the next week, when you decide, you know what, we did only 10 of this skill, no problem, we can bump it up to 20. That's 100% increase of that particular skill, but overall you're adding 10 more to the number of that they've already done in other exercises. So if you increase 10 at every single one of those skills that I just referenced, the increase becomes huge. In case that was confusing what I just said, because I think I may have confused myself, let's say in a given week, you're doing 3 different conditioning exercises or skills that tugs at this hamstring. If you increase each of them, and you may be increasing each of them a little bit and thinking that's a good management of volume, but you have to consider that you're increasing 3 or 4 different types of skills that are tugging at the same tissue. So that big, all put together, that could become a big increase. So managing numbers makes your job a little bit harder, but this is one way you can manage volume with your athletes. Every once in a while, I mean, right now it's not the time to have this discussion because training volumes aren't going to be really great to begin with, but let's say in a normal and given gymnastics season, every once in a while throwing in these kind of recovery weeks like we did with our hockey athletes, where their training volume dips a little bit and then comes back up. That's another way we can try to manage the overall volume that an athlete is having to deal with. Even more so, if we can try to manage the volume during growth periods, we're accomplishing, most of the battle in my eyes. And so one of the things I always talk about is the rule of 2. If you take measurements of your athletes, if you notice that they're growing anywhere around 2 centimeters in a given, period of time, let's say every 2 weeks, assume that they're going through a growth period. And that's the time when you want to reduce the volume of loading or tugging on that hamstring tissue. And if you do that, we'll be able to skate through that period of time where there's metabolic disruptions in the body so that we can reduce the likelihood of getting these growth plate related issues. And then on top of that, we want to build capacity. So we want to increase the ability of the tissue to be loaded in a greater range of motion so that if the tissue can tolerate the load, then we're not having to have that load be transferred onto the growth plate and have the growth plate be injured. Doing that along with increasing core stability given the relationship we just talked about. So here's a pathway to building capacity. Any strength coach would be able to, is taught this as it pertains to how to properly optimize tissues to be able to handle load. First and foremost, you want to build range. Obviously, since we're in the sport of gymnastics, range is required. We need to build range. We can do that passively, but we want to be able to build that range as well as passively, also with the ability to go through that range under control. So what I mean is build that range with strength. So I'm not just passively sitting, in a stretched position, stretching this hamstring tendon or tissues. I'm having myself go through those ranges under load, manageable load. So I'm building strength in the tissues in that position. So it's one thing for me to passively be flexible. It's another thing for that tissue to be able to actually absorb forces actively. And so I need to actively strengthen it in those ranges as well. Once I've done that, then I can slowly now introduce strengthening that same tissue in those same ranges with speed, because a lot of the skills in gymnastics are done very fast. So we want to train the tissues to be able to handle forces with speed. And if we don't do that and we've skipped this, then obviously the tissues aren't prepared to handle the speed. Or if we've skipped building the strength and we just go from passive to really ballistic movements, we haven't built the strength in the tissues potentially to get into the ranges that we want. And if we haven't built the passive range, we're just not going to be able to go where we need to go for the given skill. And then lastly, once we've done that, then we can sort of do the more explosive ballistic type stuff. This is generally the pathway that goes when you want to build tolerance in any tissue. You build the range, you build a tolerance under control, you build a tolerance with some speed, and then you then do it ballistically and explosively, which is what a lot of gymnastics is, explosive movements. So given that one of the ways that this secondary growth plate gets injured is when the tension in the tissue is increasing, we then should want to build passive range of motion, obviously, so that we can go through a greater range of motion. But then in that range of motion that they gain, we want that tissue to be able to handle load, handle forces, so that those forces are being absorbed by the tendon, absorbed by the muscle, and not going to that secondary growth plate. So if you've been in webinars with me before, or if any of you have purchased the gymnastics manual that I have, a lot of it are exercises like this, accomplishing this specific goal that I talk about, where we're loading the tissue in an isometric fashion, meaning there's no movement of the body. It's sort of stationary as it's pressing against some force. And we're doing that in a manner in which we're not going to risk injury, but we're going to start to build a tolerance within the tissues to handle loads at that specific range. Because just because a gymnast can stretch to that point passively doesn't mean they can actively move to that point. So we're in a very manageable way putting load through those tissues in those ranges. And so one of the ways, like I'm doing here with this gymnast, is they'll raise their leg up to the height that they can go passively, and then I meet them there and I have them press into my hand. So those hamstring tissues that connect to that bone, that growth plate, are being loaded. And they can do this to the maximal intensity, or if there is pain, let's say they're currently dealing with an apophysitis or growth plate related issue, they do it within the intensity that's pain-free. And so after a certain period of time of doing this, it could be 10, it could be 20 seconds. It all depends on the athlete and how we need to develop it. They stop pressing down and then they start to try to lift up, and they'll invariably be able to lift a little bit higher. And so as a result, we meet them at the new height and again, load the tissues again. And in doing this, we gradually are able to take those tissues to a greater and greater tensional point or stretch under load. So this is one of the ways we build strength through that range. Once we've done that, then we can sort of have it be a little bit more dynamic. So this is an exercise where I just have like an object out in front of me and I lift my leg over top of it slowly and I lower it down. So what I'm doing is now actively using the other muscles that typically are utilized during a front leap, for example, a split leap, and working and strengthening them so I can sort of synergistically work with the hamstring muscle so that tug and pull in both directions is equal. So we don't have too much strength on one side more than the other. And then finally, we can continually to sort of extend that tissue. This becomes a little more specific to the sport of gymnastics. So when you do a split leap, the muscle that's primarily driving you up is all the muscles in the front of your hip and thigh. So here what we're doing with this exercise, what I'm attempting to do in this picture is I'm driving my leg into that medicine ball so as to engage all these muscles in the front side of my body while I then start to extend my leg. Two things happen is my leg wants to extend. It becomes harder for me to keep my thigh or knee pressed against that medicine ball. It's going to want to start to lower. Obviously, the gymnast in this case will fight that so that they can build the strength in the front of their hip so they can straighten their leg entirely out. And if they can do that, then they're building sufficient strength on the opposite side of the hip so that the hamstring isn't demanded of to have too much tensional force being put through it, too much tugging happening within it. So this is how we progress from loading in specific ranges the actual hamstring tissue, and then pairing it with some dynamic movements of the muscles that synergistically work with it or antagonistically work with it as you go through a kicking motion like a split leap. And then eventually you then get to the point where you start to load that tissue again in a manner where we're doing it with some speed. So in this picture here on the left, it was supposed to be a video, but I guess the video is not going. I start off, in this position and I slowly slide out eccentrically into a front split position. And during that whole time, my hamstring tissues are all having to build the capacity to tolerate load as they're going down. So next time when I'm having to kick up, if I'm doing a split leap, those tissues can tolerate a little bit more load, and they can do it with some degree of speed, right? Because as someone goes through a split jump, these muscles in the front of the hip are concentrically working to shorten, but these muscles are eccentrically being loaded and lengthening. So we need to eventually incorporate some eccentric loading of those tissues, because when they do a leap, those tissues are going to be loaded eccentrically. Now, I mentioned in this bottom right, I'm doing like a hip thrust type exercise, but I have a yoga block in between my knees, squeezing them together. The reason for that is I'd want to also incorporate some strengthening for some of these hip muscles, the inner thigh muscles that connect to that same growth plate. And this is one way I can do it that allows me to strengthen not only the hamstrings, not only the glutes, but also these inner thigh muscles that connect to that same area. Finally, let's say I have a gymnast that I want them to work on doing kicks. If they just do the kicks with poor core stability and control, we have that sort of really poor pelvic movement that happens. So one thing we can do is we can start to train the body to develop that core strength and stability while the kicking motion is going on. So in the top picture, this gentleman's taking a couple of bands, has pulled it down to their side, and in doing so, engaged their core while they're kicking their leg up. So now their core is stabilized, they're kicking their leg up, and now the gymnast or the athlete is being conditioned to be able to kick that leg up in a stable core environment so that there isn't excessive tugging or at that hamstring insertion or area into the growth plate. So when it comes to growth plate related issues, the first, I mean, once the injury happens, if you talk to a doctor, most often the thing you got to do is rest it. And that's not bad information. If it gets to the point where the growth plate is irritated what you need to do for a period of time is you just need to deload entirely, not to do anything on it that causes irritation. So that some of the irritation and inflammation can calm down. But ultimately, our goal should be that we limit and mitigate the occurrence of that even needing to happen. So if we understand when this injury manifests itself and how and what we can do to mitigate its manifestation during those times, that obviously can serve us greatly. So the take-home things that I want to be in your minds when it comes to trying to mitigate this particular injury from happening is recognizing that it happens because there's poor capacity. And poor capacity shows up not just because there's lack of flexibility, but sometimes there's a lack of strength through those range of motion that the gymnast has flexibility in. So it's not just a matter of stretching. It happens because there's changes in metabolic environment in the body. Growth has a lot to do with that. Menstruation or puberty has a lot to do with that. So and obviously the last thing is with any injury in the body, there could be an overuse of it. So if we can manage the volume, specifically manage the volume during periods of metabolic disruption, which is during growth and during puberty, we're significantly going to reduce the likelihood of the injury happening, even if capacity isn't great. But even more so, if we can build within our gymnast the capacity for this tissue to tolerate forces so that it's not going to irritate the growth plate, then we're going to be better off and maybe require less volume reduction later on when they're in their sort of pubescent period or their growth period. So building capacity becomes of utmost importance. And when we're talking about building capacity, we want active strength. We don't want a gymnast to just be able to stretch and have great flexibility. If you've been in other webinars, I've shown you pictures where a gymnast has great passive flexibility. They can bend down, all the way to their knees, but then you ask them to try to lift their leg up where their knees get down to their nose and they can't. That's what I'm talking about when there's a lack of capacity in those tissues. They have the passive flexibility, but they don't have the active strength. So we need to build that. And some of the ways we can do that is through isometric loading, gradually in those ranges of motion as we get near the edges or end ranges. We can do that through eccentric loading, like I'm showing in this picture on the left, where we're going into that split position, but we're doing it under load, so the tissues are being loaded. We can do that with being able to lengthen that tissue while the antagonist or the opposite muscle, which is the muscle in the front of the hip, is working, like happens in this picture here in the bottom right. And then finally, trying to incorporate speed, like the top picture, going through those leaps, but trying to pair it with some degree of core stability or core control. If we can do that, and if we can build that capacity, the likelihood of growth plate related issues significantly goes down. And then more importantly, the likelihood of an avulsion fracture, which is the future of an apophysitis, or at least the possible future of an apophysitis, we can significantly reduce that. And although avulsion fractures are not as common in gymnasts in this area, growth plate related issues in this area are very common. So doing these things will significantly reduce the likelihood of it. I want to open the floor for questions that you may have, but before I do, a few things. If someone does get injured and they do develop an apophysitis or growth plate, it's pretty easy for it to be diagnosed. So if you're working, or if they have a really good therapist, it should be really easily diagnosed. There's a few things that we look for that you don't even necessarily need x-rays. All of the x-rays are what confirms it. The first thing that should be done is you should stop putting that tissue under excessive load or tension. So it requires a degree of deloading, or not having that tissue be tugging on that bone or loading that tissue. That period of time and how long that period of time is depends on whether the athlete is getting really good treatment and the severity of it. So you may find after a couple of weeks, you can slowly start to gradually come back to the sport. But what you'll need to do when you come back is loading of the tissues to better tolerate forces going through that growth plate. So even if they, at the earliest, they come back in 2 weeks, that may mean they're doing a lot of these exercises and no leaps, no stretches, no nothing like that for a few longer weeks. Growth plate related issues, once they sort of manifest, what I found with really good treatment is within 2 to 4 weeks, it can be calmed down significantly. With no treatment, sometimes it can take 6 months. So don't be alarmed, don't be surprised, don't, if your gymnast, once they develop it, that it takes a long while for it to recover and feel better enough for them to resume normal gymnastics activity. During those 6 months, though, a lot can be done to build strength and tolerance within that tissue, which can help speed up the recovery, but for sure help ensure that when they go back to the gym, there isn't a likelihood of reoccurrence or re-injury or potentially in the future avulsion fractures. Okay, so I'm going to take a pause there, and I want to give you, anybody who's here who has any questions, an opportunity to ask any questions. Don't have any questions or thinking about a question or typing a question, I'm going to take this opportunity to just mention again, if any of you weren't on previous webinars, I put together this little email that I'm sending out to gymnastics coaches and some therapists who work with gymnasts. And the email is just like gymnastics tips and tricks. And I cover different exercises, different topics, different thinking points as it pertains to tips and tricks to improve the strength and the capacity of your gymnast and conditioning of your gymnast. So I'm holding to send out the next email till at the end of this webinar, just to get everyone who is interested from these 3 webinars included. But the last few that I've sent out have been on wrist, improving wrist range of motion and reducing wrist-related injuries. Some of it was shoulder mobility. If any of you have gotten the gymnastics manual that I have, some of the things that I talk about is from that manual. Some of the things that are building on top of what was mentioned in that manual. If you're interested in that, just shoot me an email, and you can let me know to include you on the mailing list of when I send these things out. And what I'll probably do is send you the previous ones that I've done already before I send the next one out, so you have a copy of all the older ones. All right. Any questions at all about, oh, something flashed. Let me see if this is a question. Does passive flexibility have any value? The more I research, the more it seems like PNF and active flex are the way to go. So I'll answer that in saying that, again, with the majority of gymnasts who are prepubescent or even pubescent, if they're having flexibility issues, meaning they're not getting their legs or any part of their body in the position that you want them to be in, in my estimation, 95% of them, it's not due to passive flexibility issues. It's due to a lack of strength. So that lack of strength is what needs to be improved. And there are specific ways that you would go about improving that lack of strength. Some of the specific ways are the ways that I talk about in that gymnastics manual, but it's a strength issue. And so it's the strength that you need to address. And it's not the normal kind of strengthening that typically is done in the sport of gymnastics. So it's specialized type of strengthening. And if you've been in previous webinars of mine, I've talked about it takes a unique kind of loading strategy to load those end ranges to be able to improve active flexibility. There are some people who require passive flexibility, meaning just stretching, passively stretching. And they generally tend to be mostly the older athletes, but there's a 5% or so younger gymnasts who may need it. But generally speaking, no. I mean, I'm for someone my age who's never done gymnastics, if you see me, I have really good flexibility. I don't do any stretching at all. And the gymnasts that I've worked really closely with, now in the sport of gymnastics, you're always stretching, but a lot of their range of motions, like just actually before this particular webinar, I had a gymnast who came in, and in a matter of 4 weeks, we had improved her shoulder mobility and wrist range of motion, and she didn't do a single stretching exercise for it. It was all active loading, specific type of exercises to improve it. So what I would say is that in the majority of cases, it's if not, the biggest of majorities, maybe 95, 99%, it's not passive flexibility. That's the issue with your gymnast. And a lot of times if we passively flex excessively, that's a tug on the growth plate. So it can actually irritate or potentially lead to causing an apophysitis or growth plate related issue. So I hope that answered the question, and thank you for the question. Any other questions? I'm getting a few thank you messages. You guys are very welcome. It's a real, I really wish I had the opportunity to do this in person, because I can then show you practical things and have you feel it in your body. But I appreciate the opportunities, even in this manner, to do it. So I thank Gymnastics BC for providing the opportunity, and your attention, obviously, for being here to do it. It's a real passion of mine, and I'm happy. When I first got involved in the sport of gymnastics, and the very first presentation I did on some of these topics was actually with our national team. Since then, a lot has changed in the sport, and I've seen it change in the sport, which is great. And I'm not saying I'm the only one who's contributed to that. We have a lot of really great ICE team members on the national team who've done that, other therapists. who are involved with the sport who've done that. But it's really great to see, because I have seen really positive changes within the sport that I think is only going to make the sport healthier for the athletes and more enjoyable for the coaches, because you'll be able to, accomplish more with your athletes when their body does have the capacity to do things that you want them to do. I know it's been a challenging year for everyone and everywhere, but especially in sport and in gymnastics. But hopefully, when all this is said and done, you'll have so much more ammo to be able to take back to the gym and to and produce some really great healthy gymnasts. So on that note, given that no more questions have come in, I will once again thank you for your time and your attention, and thank Gymnastics PC, and I'll pass it back to Crystal. She wants to finish up.
Thank you very much. It's been great to have you for all 3 sessions. It's nice when we're able to get you back year after year. Thanks to everybody who has joined. This webinar will be available on our YouTube channel in the coming days. And thank you very much for coming. All right, see you soon.